Hi, I'm Judy. I'm a student nurse here. I've been chosen to do your physical assessment. What would your name be?
My name is Rokas Peckinpah.
Okay. All right. Do you need to use the restroom?
Yes, I probably should.
Okay, let's do that before we get started. All right. Have a seat there. So before we got started with this, they took your blood pressure out there and your checked your respirations, your O2 saturation, your blood pressure, and they also asked you if you had any pain. And did you have any pain at this time?
No, I have not.
Okay, great. Well, I'm going to pull the curtain here. Give us some privacy, and I'm going to wash my hands here again. And then I'm going to start with your head and work my way down, and we'll get through this, okay? First, I'm going to check your hair. I'm going to check your scalp. I'm going to look for any obvious signs of anything going on with your texture of your hair or bumps on your scalp. Everything feels fine there. Okay. Sorry.
That's all right.
Okay, next I'm going to check your ears. I'm going to check your ears for any bumps or any swelling, and temperature-wise, they're fine. The color's fine on them, no drainage. I'm gonna check this one over here. Everything looks good there. I'm gonna press around on your sinuses. Will you tell me if anything feels tender here when I push on it?
No.
It's fine? Okay. I'm gonna check your dilation of your pupils, and we'll start with this one here. Just look at my finger. And that one's, they're equally reactive. His eyes have no redness, no discharge in them. Everything looks perfectly normal. Next, I'm going to look inside your nostrils. And everything looks fine there. There's no drainage. They're pink. The septum is not deviated. Everything looks good. Now I'll look inside your mouth. And I'll check your teeth and your gums and your tongue. And tonsils look good. Everything looks healthy in there. Okay. Next, I'm going to have you follow my finger here. I'm going to move it in and out. Okay, now look up in the corner of the room and back to my finger here. I'm sorry, look up in the corner of the room and back to my finger. Okay, everything looks fine there. Next, I'll feel your neck to see if there's any bumps or anything going on there, and I'll feel your carotid pulse on this side. +2. +2, equally strong. I'm going to feel down your shoulders here. Does anything hurt when I push on your chest here? Everything feels normal. I'm going to feel down your arms. I don't feel any bumps. Temperature is warm, is normal. Check your brachial pulse. And your radial pulse. Okay, they're equal and strong. I'm going to have you squeeze my fingers.
Hard?
Don't hurt me.
Okay.
Squeeze a little hard. Okay, good. Good strength in your hands. I'm going to check your fingernails. Capillary refill is good. Okay. Everything looks perfectly normal there. Okay, next I'll listen to your lungs. Deep breaths. Two. 3. 4. 5. And 5. Okay, I'm going to check for his aortic function of his heart. Just breathe normal. And over here, I'm going to come down to his second intercostal space and listen to his pulmonic heart sound. And now his tricuspid, down here to the 4th intercostal. And then down here to the mitral, on the 5th intercostal space. And if I was going to listen for the apical pulse, I would go mid-clavicular, straight line down to his 5th intercostal space, which was right here. And this is where I would find this apical pulse, and I'd listen to that for a full minute. But for the sake of the video, we'll just point it out. Next, I'm going to listen to your lungs from the backside. Oops, 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 oops. First, I'm going to palpate down his back. No bumps, no masses that I noticed. Temperature's normal. Okay, I'm going to listen to 8 different spots on his back here. One, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, and 8. Okay, next I'll have you lay down on our table here. And because we have a longer patient than we have a table, we've had to extend it. Thank you for cooperating. Okay, first thing I'm going to do is listen to the intestines and see if they're gurgling and moving his food through his system. I'm going to start with the lower right quadrant and work up to the upper right quadrant and the upper left quadrant and the lower left quadrant. Dinner's moving just fine.
So if it's gurgling, that's good, right?
Gurgling is good. Next, I'm going to palpate. Let me get rid of this. I'm going to palpate on your quadrants here. Tell me if there's any tenderness. I don't feel any swelling, nothing, no hard masses. Everything feels perfectly healthy. Next, I'm going to feel for your femoral pulse. Even. Next, the popliteal. And then the pedis dorsalis. Pedis dorsalis. Or dorsalis pedis, I think. And then the arterial, posterior, dorsalis pedis and posterior tibial. Posterior tibial. Sorry. Okay, even and strong. Next, we're going to feel his legs, feel for any masses or softness in the skin or hardness under the skin. Everything feels perfectly healthy except for all these chigger bites. Okay, I'm going to have you pull your feet up toward you. Alright, now push down. Inspect your toenails. Your toenails look healthy. Capillary refill help you sit up here and swing your legs around. Okay, do you have any questions,
No.
or have I caused you any pain?
No, we haven't.
Great. Okay, thank you, and I hope you stay good and healthy.
Thank you.